Good morning, everyone, and welcome to our last session of the Tennessee Fall Prevention Coalition's virtual program demonstration series for National Fall Prevention Awareness Week. My name is Sydney Shutrow, and I'm a member of the Tennessee Fall Prevention Coalition. Governor Lee also made a formal proclamation recognizing September 20th to the 24th of this year as Fall Prevention Awareness Week in Tennessee. This series would not be made possible without our amazing coalition members who helped develop the data collection surveys that you all did at registration, volunteered to speak at the series, and strive every day to educate, promote, and provide programs and services across Tennessee to reduce the occurrence of falls in older adults. Thank you all so much from the bottom of our hearts for everything that you do. For our audience, this session is being recorded, and you have all been placed on mute or will be placed on mute very soon to reduce background noise out of respect for our presenter. If you have your camera on, now is the time to consider turning it off if you don't want to be seen on the recording. We're going to post this publicly on our YouTube channel, so throwing that out there now. If you have any questions or comments to interact with the speaker, we encourage you to share those using the chat box feature, and we'll address questions throughout breaks in the presentation as well as at the end of the presentation.
Hey, everybody.
Oh, hi, Rachel. We have a wonderful presentation for you today that will discuss the Walk Across Tennessee program. There may be a part of the presentation where the speaker will ask you to join them in performing some exercises possibly. So if that does happen, we want to encourage you all to participate, but we want to make sure that you do that safely. So please be sure that you're wearing comfortable athletic shoes, preferably closed-toe shoes. Have the area around you clear of any objects that may be a tripping or fall hazard. Have some water handy to stay hydrated. And if you need to take a break, of course, please do so at any time. So without further ado, I want to turn it over to Dr. Jarvandi, who is going to tell us a little bit about herself and lead this discussion today. So thank you so much, Dr. Jarvandi, for being with us today. We appreciate it so much.
Thank you very much, Sydney, for introduction. Good morning, everyone. Thank you very much for attending this Walk Across Tennessee session on Friday. My name is Soghra Jarvandi, and I'm a faculty member with UT Extension. First, I would like to thank the Tennessee Fall Coalition for Fall Prevention Coalition for conducting this virtual series, and a special thanks to Sydney Shutrow to make these sessions happen. I hope you enjoyed the previous sessions this week. This is the last session of this series. So today is about the call to action. Today we talk about walking, which is the most common physical activity, and people at all ages, they can do that. So it does not need any special skills, equipment, or training. So I don't need to demonstrate that. It's very easy activity. It's fun and available for most people. I understand we have some challenges sometimes in terms of finding sidewalks and places to walk, but in general, walking is available for most people, either indoor or outdoor. So let's start with a poll question to see how familiar you are with Walk Across Tennessee. Sydney, please. Thank you.
Okay. So I have launched the poll, and the question is, have you participated in Walk Across Tennessee before? And your answers are yes or no. So we'll give everybody about 10 or 15 seconds to type in their responses. I know some of you have mentioned in the past that you've had some difficulty viewing the poll questions. So if you wanted to respond in the chat, yes or no, please feel free to do that as well. Just a couple more seconds. We have about 7 responses, so if we could get a few more, there we go. Got one in the chat, okay. Alrighty, so our responses are 38% have said yes, that they've participated, and 63% said no.
Great. Thank you very much for participating in this poll. It's good to know that we have a mixture of some people, they know about this program, and a large percent they don't know. So hope after this session you have some general information about Walk Across Tennessee. So this is the outline of our session. I will first briefly talk about why we should be physically active and how much physical activity should we get. Then I will talk about Walk Across Tennessee and how to join. So first about why we should be physically active. These are the benefits of physical activity. Physical activity can help us feel better, function better, sleep better, and have less risk of chronic conditions. So it seems like a magic pill, right? Regular physical activity improves our general health, also helps with weight management, reducing the risk of chronic conditions such as heart disease, high blood pressure, type 2 diabetes, some types of cancer, and falls. So how much physical activity do we need? Based on the physical activity guidelines for Americans, adults 18 to 64 years should get at least 150 minutes of moderate level physical activity or 75 minutes of vigorous level, which is higher intensity activity of aerobic activity per week. In addition, adults also should get muscle strengthening activities at least 2 days a week. The Move Your Way campaign is the promotional campaign for physical activity guidelines for Americans, which was developed by US Department of Health and Human Services. The campaign materials are available in English and Spanish on health.gov website. This is a publication that I put here as an example that clearly shows how much physical activity adults need. You can see here in this picture, they put a variety of activities. So for being active, we don't have to go to gym, but we can use just the general daily activities. Everyday activities count. Let's look at the social media message. So as you see, all different activities, they add up to have these 150 minutes of physical activity per week. For older adults, 65 years and older, it's recommended that if possible, they should follow the guidelines for adults to have 150 minutes of moderate level physical activity per week. But if not, they should be as physically active as their body allows. If they have chronic condition, of course, they should talk to their doctors to see what type of physical activity is safe for them and how much physical activity is safe for them. And balanced activities also are recommended because they are important to reduce the risk of fall. Sorry, I didn't proceed this. Here I put more examples of the Move Your Way campaign. You can see in this poster people dancing, and they have fun as a way to get physically active. This is another poster showing that physical activity can have some quick benefits. When we are active, we feel better. You can see the smile here. So in addition to the long-term impacts in terms of the prevention of chronic conditions, we just right away feel good. So, of different activities, what's your move? If you would like, you can add it into chat box. What is your move? What types of physical activity do you prefer to do?
We are getting some people I'm seeing that are typing. I know my personal favorite move, I'm a big walker. I do all the virtual challenges. I'm doing one of the 5Ks coming up soon. We have someone who said Zumba is their move, another walker. Got a couple more people hiking. Tai Chi, dance, and walking. Oh, someone admitted that they've been undesking their bodies lately. I like that, undesking. Walk and line dancing. We have a couple more people who are typing, but I know a lot of people that I've talked to also who are older say gardening, especially in the spring and summer, were big. Someone used to run, but because of some back issues, no more running, so just walking. She says she feels very old, but I don't think that she's old. And I think this is the last one coming in, just being outside, walking, hiking, and being in nature.
Thank you, Sydney, for sharing, and thank you all for participating in this. These are great examples, and the last one, just the relaxing. So it's not just for physical health, but for emotional health and feeling well. These are great examples. So with this introduction, I will now talk about Walk Across Tennessee. This program started more than 20 years ago in Tennessee. But since then, most UT extension offices in different counties, they have offered this program to thousands of Tennessee residents. It's a team-based program. It's a team-based walking program. It's the virtual walk across Tennessee. We don't walk actually across Tennessee. But as you see in this map as an example, starting from Mountain City in east to Memphis in west, which is about 500 miles. So team together, they try to walk all these distance. The duration is usually between 6 to 8 weeks because different counties, they may choose different duration for their program. Team members are usually 6 people, and one of them is the captain. Team members, they don't need to walk together, they don't need to meet, and even they don't need to be in the same location. So everything can be done virtually, and that's the good way, especially during COVID, because with this program, we can stay motivated and be active as a team together. How does it work? In terms of different activities, the name is walking program, but actually different types of activity they count. People, they may choose dance or run or walk or do garden work or any kind of physical activity, but all activities are converted to miles using a mileage calculator, which is available both as PDF and online format on Walk Across Tennessee website, as you see here on this slide. For data collection, members report the mileage to captain on a weekly basis, and captain reports mileage for the team to the program. During the program, either 6 or 8 weeks, participants, they receive educational and motivational messages to stay motivated and continue the program. So what are objectives of the program? First, to improve health and wellness, to develop a more physically active life, to help improve both physical and emotional health, and to prevent or manage health conditions, and for weight management, to decrease the overweight and obesity trends that we have across the state. Based on the CDC adult obesity rate that was published recently, Tennessee is among the 16 states that they have adult obesity prevalence at or above 35%. So what do people say about this program, when they participate? Because we collect information and we hear lots of success stories. Here are some examples that they were reported as benefits of the program. The program helped the participants to increase their energy level, reduce their stress, and improve sleep and lose weight. Just as an example, in 2019, more than 900 teams of participants, they participated in the program, and they reported a total weight loss of more than 2,000 pounds altogether. So why join this program? First, to get fit, and then enjoy meeting new people and have fun. Also to improve overall health. These are two publications that it's the summary of what I presented about physical activity and the Walk Across Tennessee program, that they are available on our website. And this is a screenshot of the Walk Across Tennessee website. You see on top right corner is the mileage calculator. So you can click on that and use the mileage calculator to see, when you have different types of activity, how to convert them to different mileage. So I stop here for a few seconds to see if there are questions, and if you would like maybe to have some marching place and a stretch.
No questions have come into the chat box just yet.
Okay. Okay, so we continue.
Oh, we have someone typing in, so there might be a question here in a second. And in the meantime, I'll ask a question. So this series has been really wonderful, to where not only have we had people in Tennessee, but we've had people outside of Tennessee joining us. Would it be possible for someone who's outside of Tennessee to participate in Walk Across Tennessee, or is it specifically for Tennessee residents?
That's a great question. Actually, after COVID, we all learned about all virtual, and even not limiting the program to one county, even additional or more counties. I think it depends on the counties who offer these. They can contact the counties who offer that, and then why not? They can participate.
Great, thank you. And a question did not come in, so I think you're good to continue on.
Sure. Just I wanted to mention, even in other states, there are different names and different, the same program. Tennessee is not the only state who's offering that. So it would be good people from other states also they contact their extension offices in their own state and to see what programs do they have. Okay. So the question is that if you are interested to join such a fun program with all the benefits and it's easy and available for everyone, so how can we join? These programs are offered by county extension offices in each county. So you should contact the extension agents, family and consumer sciences agents in your county and to see if they offer this program and when do they offer that, so then you can join the program. Just for some examples, I put here some of the counties that they are active right now and they offer this program. In extension, we have 3 regions across the state: Eastern, Central, and Western region. So in Eastern region, I put here the counties that they offer this program during this fall and winter. So they may have already started, or they may start this week, next week, or in winter. It would be best if you just contact your county extension agent and see if you can join the program. So these are just for the fall and winter, but the other counties that they are not listed here, they may offer this program in spring or later. But just wanted to tell you, this is a very popular program. And as you see, some counties, even they use maybe different names, but different variation of Walk Across Tennessee. You can see in different counties, even some of them, they partner together. For example, these 4 counties, and it's called Move Around the Region. So, and there are some variation also, the way that they offer the program. These were the basics of the program that I described here. But in terms of the number of people and the name of the program, there are some changes, but the basics are the same. So these are in Eastern region. These are the counties that they offer in fall and winter in Central region. I included the county name, name of the agent, and the name of the program. Here is the Western region. As you see, this program is very popular, and they also have several counties partnering together, and they offer it as Tennessee River Walk. So I just wanted to conclude with this, that if you were active, you can improve your physical activity, or if you were not, you can start being active today, because it's never too late to start getting active. But what is very important is the safety of physical activity. So while we are active, we need to be make sure that we do that in a safe way. So start low. Search for the resources in community. One of these resources might be this program, and work at your own level. We all have different fitness level, So we need to know our own level because of the safety of the physical activity. And go slow. So whatever is our goal, we want to reach to that goal of physical activity. We don't need to reach that, and we should not reach that, in a short time. We should reach that over time and very, very slow. And the other thing is get advice. Always ask for instructions from professionals to improve physical activity. This was very quick, and I'm happy to answer any questions that you have.
Thank you so much. This has been a wonderful introduction to the Walk Across Tennessee program. And I know we have a couple people who are older adults who hopefully will join the program. And for many individuals, they're staff at local agencies. So hopefully if you are conducting a class of some kind, you can definitely tell your participants about Walk Across Tennessee. Dr. Jarvandi, I think we have a couple questions coming in, but is there any cost to participate in Walk Across Tennessee for the participant?
Great question. No, this is a free program. And in different counties, because of course, similar to other extension program, we do that through partnership. So different counties, they have different partners, but of course, a variety of partners are involved in this. And even they help with adding prizes for participants. So there are some even incentives, but different counties, it's different based on their partners, but there is no cost associated with participation.
Great. And are you willing to share your slides that you've developed with us so I can send out all the information so people can find their local Walk Across Tennessee or whatever they call their program?
Sure,
Great.
absolutely. Yes. But I just wanted to again emphasize that this list, it doesn't mean that these are only places that offer Walk Across Tennessee. These are examples of those programs that they are for fall and winter. But you can go on the website and find the local extension office, family and consumer sciences agent and contact them, because the list of the counties that they offer it is much more than what I presented here.
Absolutely. June presented to us yesterday on Tai Chi, so she sent me the link to all the extension agents. I'll be sure to include that in the follow-up for this presentation as well. We did have a question come in. Will there be, or do you have any data showing engagement, benefits? I know you mentioned one group lost 2,000 pounds, but do you see any kind of data with people who sign up and then maybe don't participate or don't report their data, or do you have any kind of other data points that you could share with us about the program?
The data, the one that I shared, it was across 1 year and all different counties. We don't collect detailed data, but the basic data that we collect is about how many miles do they walk and how much weight do they lose and how many teams do they created. These are the basic data. But in addition to these, sometimes we have some qualitative data that people, just I heard from some participant that they said we couldn't walk long time before, but after this participation, now we walk more. Or some people, they said after these 8 weeks of the program, now walking is part of their daily lifestyle. They just continue to walk. So these are the data that just lots of success stories that I can say they are more beyond just the numbers. These are the qualitative success stories that we hear from people.
Yeah, sometimes the stories are even more impactful than the numbers. You have to have the stories behind the numbers. So is there some follow-up after walk across Tennessee? So once the 8 weeks is up, is there any kind of follow-up for participants?
Not with all data, so we don't have follow-up data for all program participants. But in some counties, they may hear from participants like 6 months after, if they still want to, or if they are still active in physical activity and continue that, but not consistently. We don't collect that 6 months follow-up data.
Just a reminder for anyone else who has any questions, you can feel free to unmute yourself as well and ask your question, or you can continue to type those into the chat box. So while we're waiting on other questions to come in, I think this was a really excellent way to end our series because as you mentioned at the beginning, this is really our call to action. So we've gone over the data on Monday and the importance of kind of putting your team together to make sure you prevent falls. Then we talked about Matter of Balance, which is a really great program to kind of ease you in as you start to exercise again. Of course, walking is probably the number one, like you mentioned as well. A really easy way that if you haven't exercised is just go out and walk, maybe a tenth of a mile or just small increments at first, and then Matter of Balance, you get a little bit of the exercising and the conversation. Tai Chi, you get a little bit more of the slow, fluid movements. And then Sail, you get a little bit higher intensity exercise. But it's every program that we've talked about, including Walk Across Tennessee, can all be adapted to anyone's ability level. So as you mentioned again, it's called Walk Across Tennessee, but you can do anything. You can bike, you can wheel, you can, use that calculator to transition. I can't remember the name of it. The calculator where
Mileage calculator, yes.
yes, that one.
Yes, because I think the important thing about this program is that we don't need any special skills. But when we are active in a group as a team base, that helps in terms of the social support. And because for changing lifestyle or being more active, that component is very important to increase the motivation to be active.
Definitely
And as I said,
accountability.
yes, as I said, it's really fun, especially at this time in these very beautiful, nice, fun fall days. It's a great time to just go outside and explore.
I have a question.
Go for it.
We've been talking about balance. For those of us that feel like our balance may be slipping a bit, are there any special advice, or is there any special advice that you have as we start out?
Thank you. That's a great question because the balance activities are recommended for older people. But like the program, I think that was offered a few days ago. So there are like Tai Chi also. These are the programs that they can help people, but in a safe way. If you want to do any activity ourselves, so just the first step to make sure that we do it in a safe way. So other than joining those programs, for example, Tai Chi to improve balance, walking also helpful to increase balance. But again, because of the safety, we may want to walk very slowly. But when we use our muscles and improve them, so then that helps improving the strength in the muscle, and then the balance improves. So walking is a very simple, easy way to improve balance. But as I said, there are specific activities or program also that you can join, and then with those instructions, like for Tai Chi, or a special like walking backward or walking on the side, those kind of activities that they need instructor, you can also improve your balance.
Do you have any recommendations? There was a recommendation coming into the chat box that maybe for those who are starting to walk, who may still feel like their balance is not as steady, maybe using a walking stick of some kind to help. Do you recommend that, and making sure, the surfaces are even? Anything along those lines that you'd like to add?
Exactly. Yes. Yes. For everything, just I want to put the safety on top of the list, because even walking in some walking trail outside, so it seems walking it's easy, but we don't want to walk and fall. So if somewhere it's not easy to walk, like a surface is not even, or there are some challenges, we just need to find the best places, easy places to walk. Or even if we need to hold something, or even at home. So the easiest way that works for us, I think, just choosing the locations. If the place is a location that there is any risk for fall and we don't have that balance, we should not do that. Or if we need any kind of help, to use other devices, of course, using those. So for different people is different, but we need to know our own level and our own safety level for walking, because we just want to make sure that we move. But that movement, it's not a fixed quantity and level for everyone. For many, even simple activities, if you join teams that join some classes, they ask that you can hold on a wall or a chair, something next to you, especially if people, they have some chronic conditions or use medication, or for many of us that might be challenging, or to have that balance, especially if we start. So the best way is to start at the very, very low level. So to see what is our comfortable level. Even walking, if 10 minutes is too much, so we start with 5 minutes.
Sydney, I'd like to say something about balance, walking and balance. And I know there's been some studies that have been done, some research that I've read, that walking doesn't necessarily, it's good for the heart, of course. It does, it's, weight bearing. It does, help or keep our bones strong. Of course, our muscles, and just staying active, period, is going to help us to reduce our risk of falling. But I want to say that if your balance, and again, as we get older, our balance does, we do become challenged in that way. And I know earlier we had a session, a presentation on the SAIL program. So I highly encourage, I don't know the lady's name that just asked that question, but I highly encourage you to look for a SAIL program, because the balance portion of the SAIL program is very specific, and it's asking you to do things that, and it helps our brain too, because it's challenging things that we wouldn't normally do. We don't normally stand around on one leg. We don't normally put one foot in front of the other like this, and hold that stance. So there's a lot of things that, yes, walking is awesome. It's good for our heart. It's good for our overall health. But I would encourage you to look for programs that do have specific balance components to them, because that is what is really going to increase your balance and help you with that. Does that make sense, everybody?
Thank you, Rachel.
Yes, and thank you for that answer, and yours too.
Thanks for the question.
Alrighty, let's see. I don't see any other questions that have come in. I did have a quick question. For Walk Across Tennessee, is there an age limit, or can anybody? So if someone who may be a little bit older wants to get their grandkids to spend more time with them and walk with them, would that be something that would be open to all ages?
It depends on the counties. Some they have some format for the younger or for youth that they offer that. In some places, in general, it's for adults. But I think the best thing is to check with the program that they offer.
My questions are always a depends questions. I apologize. Alrighty, I don't see any other questions that have come in, so I just want to go ahead and wrap this up, and we'll stop the recording for anyone who wants to ask some questions that doesn't want to be recorded. But thank you so much, Dr. Jarvandi, for being with us today, and thank you to all the presenters and everyone for attending this series. This week has flown by. I can't believe it's already Friday, and Fall Prevention Awareness Week is over. It's crazy. We will be sending everyone kind of a series evaluation, so here in the next, probably by this afternoon. So I hope everyone takes the time to give us some feedback on how to improve this series in the future. But thank you everyone so much again. We really appreciate it, and have a great weekend.
Thank you very much.